clinic at Children's has a very, very unique population with a lot of pathology. In a private office, you might see a lot of children that need glasses. We certainly have some of those here, but this is a real referral center and a sort of the bottom of a big funnel that people with real problems come to.
We take care of approximately 35,000 patients out of 4 offices, and 8,000 of those patient visits are actually at Children's Hospital, where the fellow spends most of their time.
Our residents and fellows are exposed to this group of patients that they might not be in a setting that does not have a level 4 neonatal intensive care unit.
Because of the wide variety of the cases that they see and the high volume of surgery, we get quite a few residents that develop a strong interest in pediatrics and do pursue pediatric ophthalmology fellowship.
Our fellow may not have had a lot of peds experience. So coming to Children's, we have so many attendings who come from different backgrounds.
More attendings that you have that bring their own little differences to the same procedures, I think is huge, because then you develop your own ability, or in the event that something were to happen at the time of surgery, that you can kind of pull from all those different experiences and go, I need to make an adjustment here.
The clinical staff, the physician staff, includes 9 fellowship-trained pediatric ophthalmologists from a very diverse background. This is one of the strengths of the program. In the fellowship, you'll have an opportunity to work with orthoptists, which are well-trained folks in the field of sensory and motility.
There's so much that we can tell by just watching. Does this child have a head posture? Is this child covering an eye? Does one eye look different than the other? And what an orthoptist brings to that is really getting into the sensory aspect of strabismus that fellows and residents may not be getting elsewhere.
I think it's a part of training is to have those fellows in the operating with you so that they're actually doing the surgery, and if they start having problems and issues, you're helping them so that when they're on their own, they're not doing this for the first time when they see certain complications and issues come up.
With regard to surgical volume, we see well over the 75th percentile of the AUPO requirements for fellowship training in pediatric ophthalmology. This includes hands-on surgical experience, not only in strabismus and adult strabismus, but also in pediatric glaucoma surgery, as well as cataract surgery and plastics.
When I got back here, I hit the ground running. My dad had saved me some strabismus patients, so I came back and day one, the first week I had some surgery.
Fellows go to many different places afterwards. We do have some fellows that will do comprehensive ophthalmology and be the pediatric person for the eye group. We have quite a few fellows that are involved with academic programs, as well as several fellows that have gone into private practice as full-time pediatric ophthalmologists.
My hope was coming out of my fellowship that I would feel comfortable with all aspects of pediatric ophthalmology, and I really felt that happened. You'll get excellent surgical training, you'll get excellent volumes, both exam and surgical volumes. If you want hands-on, you're going to be in private practice and you're going to be seeing people all day long, this is a very strong program.
I personally love going to work every day. I was blessed to find this field. I've had a very rewarding and wonderful career, and I couldn't see myself doing anything else in the world.